And ask anyone who studies these issues, it made it worse. Meaning we need to understand that when you just rip meds, when you rip meds away from people, no. When you rip meds away from people, you actually have to have some kind of fallback that helps them and rehabilitates them. Otherwise, they go to the street to buy street drugs.
Comedian and progressive host Francesca Fiorentini was a guest on Piers Morgan Uncensored to go up against a panel on Piers Morgan show that included rich guy who wants to live forever, Brian Johnson, MAGA business grifter Grant Cardone, and Dr. Deborah Birx, who was Trump's coronavirus response coordinator. I like to do these Piers Morgan Uncensored videos because I get a lot of people that say they like to watch these on my channel so that they don't have to go and give the clicks and views to Piers Morgan. So I appreciate people doing that. We're going to take a look at this panel that includes Francesca Fiorentini talking about RFK Jr. and healthcare in our country. Let's get into this together.
And by the way, he helped get Donald Trump voted in as a mandate. The country wants change, and it is willing to confront the status quo.
I also think with him, Francesca, there are some, definite disingenuous attempts to misrepresent him. I asked him categorically, is he anti-vaccination, period? He said absolutely not. And in fact, his own kids have been immunized against various things. He's very skeptical, as many people are, about the COVID vaccines, particularly the mRNA vaccines. I was with, for what it's worth, one of the top cancer experts in Britain for lunch a couple of days ago, who was utterly scathing about the long-term impact of the mRNA vaccines, Pfizer and Moderna, and says that they're reaping a whirlwind in the world of cancer, for example, as a result of the vaccines. Not to say that I personally believe they saved many lives, but did we have enough time to examine the potential consequences? Almost certainly not. So he's been skeptical about that, but he's not anti-vaccine, as many people like to portray him.
Except that he founded an organization, the Children's Health Defense League, that is straight up against vaccinations. They are selling onesies for babies that says, unvaxxed and unafraid, right? Like, that's what they're doing. They're an anti-vax organization. That's what he has done for decades now. I just want to name, trust me, if we think that ripping people's psychiatric meds away is going to be beneficial for the health of this country, you have another thing coming. We are going to see.
Actually, I do think it's a good idea. Well, hang on.
Drug epidemic.
Hang on.
We're gonna.
No, you hang on. To answer that point, I do. America is ridiculously over-medicated, particularly in the area of antidepressant drugs and anxiety drugs and so on. And Britain's going the same way.
No, I think it's great. I think it's great.
There are millions of young people.
You know what happens?
Hang on, Francesca. Hang on. Don't start shouting. Don't start shouting. Let me put a question to you.
I bet money that Francesca's on drugs right now.
Francesca, let me put a question to you.
Not nearly.
Hang on, guys. Hang on. Can you both please hang on?
What happens is,
Francesca,
rip people's medications away.
Can't stop.
Let me make a point, please. Let me make my point. Let him respond.
I feel like I'm
going to stop here for just 1 second just to say I love when Francesca Fiorentini is on these shows to put these clowns like this Grant Cardone in place. I don't know if you heard what she said there, but he said she's probably on drugs right now. And Francesca said, not nearly enough to deal with your grifting ass. This clown is not used to people talking to him like that, and he's not taking it well.
Everyone stop talking for a moment. Francesca, the point I'm making is America has 80% of the world painkiller consumption. 80%, right? You have millions of don't respond yet, millions of young people who are taking completely unnecessary, mind-bending drugs for things like anxiety, depression, often self-diagnosed. And guess what happens? You then have a load of weirdo, loner kids running around with their brains scrambled who commit mass shootings and stuff like that. There is a direct correlation. And we're going the same way in Britain. Young people are getting massively over-medicated. So I am actually in favor of RFK trying to pull America away from its addiction to mind-bending drugs.
there's a real life example for what happens when you kick people off of painkillers, which I agree. Painkillers were overused, specifically the Sackler family, when it comes to OxyContin, right? We all know this infamous case got millions of people addicted to OxyContin when they didn't need to be on such a heavy opioid, right? And so what happened? Rightfully, doctors started rescinding those scripts, which was good, but then people were already addicted, so they sought painkillers on the black market, which were mostly just heroin, opioids, fentanyl, and whatnot. And ask anyone who studies these issues, it made it worse. Meaning we need to understand that when you just rip meds, when you rip meds away from people, no. When you rip meds away from people, you actually have to have some kind of fallback that helps them and rehabilitates them. Otherwise, they go to the street to buy street drugs. Everybody knows this. It's well proven. But again, what do I know? I'm not trying to hawk supplements. Here's what I'll say.
Can we just go back to talk about the health issues? Because I think I'm really hoping that we can have that discussion, because I think, and I really appreciate you all being open-minded, that he's bringing a new tone to the investigation and really talking about diagnosing disease early. And I love the AI approach. We have reams of data in our electronic medical records, and we're not using them. Data should be used, and we can anonymize it, and we can look at what people's risk factors are, and we can do so much with the information we already have, and we can find solutions. I hear you talk about Texas and the immunization rates there. That issue is in one of our very culturally special groups in West Texas that has had a vaccine exemption for decades. It's in, we all know our Amish and Mennonites have always historically been vaccine hesitant. And I think, so you don't group that situation in Texas with the rest of the country. And let's remember what he said in the hearing. He made it very clear to every mom out there that his children were immunized about childhood vaccines. Yeah. And what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again. And this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed to prevent against infection. And if you look at the vaccine hesitancy rates, they've doubled since COVID. So we have to start addressing these things. We can't just ignore them.
And Deborah, let me ask you, Deborah, I mean, given that you were the face of COVID from the Trump presidency at the time, do you share, this doctor who I was with, do you share the concerns about the longer term negative impact of some of the COVID vaccines?
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for. But when we say that we're following the science and the data, we need to follow the science and the data. And the science and the data said people primarily over 65 or people with significant comorbidities were at risk for severe disease. Those are the individuals that should have been immunized first. And we should have put our science behind our immunization schedule and protected those most at risk. It went into young people in hospitals before it went into our elderly in nursing homes. That is not following the science and the data. So I am all for following the science and the data, but it shouldn't just be a statement. It should be a reality. And when we don't match what we do in public health to the science and the data, that is when we get into trouble. And that's when we start to fracture trust with the American people.
Okay.
I want to stop here for a second and address some of the things that were said earlier in the video. So you have Francesca Fiorentini bringing up specific cases of, they're talking about Americans being overprescribed, and she talked about a scandal with opioids where they were overprescribed, where these drug companies, and she talks about the Sackler family, where millions and millions and millions of prescriptions were going out, and some of those were not necessary. And Grant Cardone, this douchebag, says, you know, you want everybody to be on drugs. And that's not what Francesca Fiorentini is saying. She is saying that we need to address the pharmaceutical companies and people being given drugs when they don't really need them versus people being given prescriptions and medications that might save their lives or improve their lives. She talked about the antidepressants. And again, Grant Cardone is huffing and puffing about that. Are there too many people in the United States on antidepressants? Probably. I'm not a doctor. I'm not a scientist. But we can kind of look around and see that maybe there are too many people on these drugs. That's an opinion. Again, I don't necessarily have facts behind that. But there are also people that their lives are saved by these drugs. So to just dismiss totally out of hand that too many people are taking these, you have to look at data. This Grant Cardone is somebody which we typically see of the right wing, that just wants to go based on feelings. So I think it's great. Dr. Burks here says, I thought we were going to have a conversation about health, which that's what Francesca Fiorentini was doing here. This is the second video that I've done on this, and she talks about access to healthcare and health insurance, which the other people on the panel, including Piers Morgan, did not want to talk about. That is a big, big aspect of our system, is people being able to afford to get treatment, to go to the doctor, to be in the hospital if you have to. I know I'm someone who I have insurance. I've had insurance for years. I have the best insurance that I can get. It's not very good, what's available in my state. And I'm terrified of what would happen if I wind up in the hospital, even for a couple of days. It would cost me a fortune even with my insurance. And that's what millions and millions of people are dealing with. Should we deal with people being overweight and, maybe somebody is on an antidepressant and they don't really need it? Yes. But we need to use a medical term, a holistic approach where we're looking at everything and not just what's going to happen with the RFK and this administration. It's all going to be trying to prevent disease by all of the onus and the responsibility being put on the person, which does not deal with what happens if you do everything right and you still wind up in the hospital. Somebody who works out and eats right, eats their fruits and vegetables, yada, 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 and they still get cancer, or they fall down the stairs, or they get hit by a car, which is millions of people in this country. But right-wingers want to make out like if you get sick, it's all your fault. And we all know people who have done everything the right way. They're healthy people. They exercise, they eat right, and they still get sick. It's going to happen to all of us, no matter what. But to deal with the actual costs, you have to go up against the pharmaceutical companies. You have to go up against the hospitals, the healthcare system, the salaries of doctors, the insurance companies. This administration isn't going to do that. They talk about additives in our food. Very little is going to happen with that. Even if RFK Jr. is sincere and wants the food to be healthier in the United States and be more like other industrialized countries like Europe and Australia and New Zealand, what's going on in those various nations, that's going to be a huge task to go up against the food corporations in our country. But let me know what you think about all of this. Do you agree with Francesca Fiorentini? Do you agree with the other people on this panel on Piers Morgan Uncensored? Let me know in the comments what you think. This is Chris on Culture. I will see you in the next video.